I started doing weight loss surgery in 1991 when I arrived in Phoenix. And the surgery I did was a Roux gastric bypass surgery. I was one of the first surgeons in Phoenix to do it. And in 1993, the Roux gastric bypass surgery had its 100th anniversary. The two changes that had been made to that surgery were the advent of surgical staples brought from the Soviet Union in the 1960s, and the change of the surgery from an open procedure to a laparoscopic procedure. But also in 1993, another invention came. And medicine advances. And the invention that came from Europe, and that was this little tool, the laparoscopic adjustable band. The laparoscopic adjustable band became the only weight loss surgery we did starting a couple of years ago. I want to tell you the reasons why. The main reason is patient safety. As surgeons, we're very concerned that our patients have effective and safe operations. We know there's a certain amount of morbidity and mortality with any operation that's done, but we as surgeons want to minimize that because we want you to be safe. And I want to tell you why the laparoscopic adjustable band is safer. We can look at a couple of statistics, one of which is called mortality, which we hate to talk about it, but it's death. Death after any surgery is one of the complications that we know that can occur. And when you look at death rates from the Roux gastric bypass, oftentimes they'll tell you it's 1 in 200 or 1 or 250, but actually it's probably more. There was a study that was done looking at 16,500 Roux gastric bypasses. It was published in the New England Journal of Medicine, and it showed that if you followed these patients for a year, there were over 740 deaths. That's a lot more than the 80 or 100 that you would predict if you were to extrapolate out the death rate of 1 in 200. That's pretty high. One of the things that we discovered when we first started doing the lap band, this little surgery with this device, was that the patients did better immediately afterwards. We've never had a death from them. And we have found that in our data, as well as data from around the world, that it is at least 10 times safer than the Roux gastric bypass. That in itself was reason enough for us to change from doing one procedure to another. But there are a few other things too. One of the things we discovered is our patients got up much faster. The operation lasts less than an hour. Patients are up walking in the recovery room in 45 minutes. Most of them go home that same day. There are some exceptions to that. In fact, oftentimes I kind of joke with my patients that the people we see who spend the night in the hospital are mothers with kids and a husband that really isn't used to taking care of them. But other than that, the primary group that we see is patients leave the hospital that day. They're usually driving within about 72 hours and back to work in a week. Now there's a range. There are people who take longer time off of work and people who have a little more pain, but most of our patients go home with Tylenol. That translates to a lot safer surgery. And remember, with a lap band, we don't cut or rearrange intestines. There's no malabsorption. A recent study showed that with a Roux gastric bypass, at 1 year, 46% of the patients had what we call protein-calorie malnutrition. Now you've all seen patients who've had the Roux gastric bypass. Some of them are celebrities on TV. Carney Wilson had it. Al Roker had it. And some of you have known people who've had it, and you see this tremendous shrinkage in their bodies very, very quickly. And a lot of plastic surgery done. Now plastic surgery is an individual thing, and everybody will have their own rate at which they want to have plastic surgery done. That's something we can't tell you that you will or won't have. But I can tell you that we're sending out a lot less people for plastic surgery now than when we did the stomach staplings. We think the reason is this. When you have the old-fashioned stomach stapling, the Roux gastric bypass, you lose muscle mass. You lose protein. You have protein-calorie malnutrition. They shrink very rapidly. With a lap band, we don't see that. We see a nice, gentle, and sustained weight loss. One of the graphics that we're going to show you now shows the Roux gastric bypass compared to the lap band over time. Because besides safety, you want an operation that will work. Does the lap band work? In the first few months, it's much slower than the Roux gastric bypass. Starting at 18 months, the Roux gastric bypass patient plateaus out, meaning they stop losing weight. And then you see them starting to regain weight at about 20 to 24 months. What you see with a lap band is continual weight loss, the ability to lose weight. We think one of the reasons is because a lap band is adjustable. we can adjust this band to your needs. So because of safety, because of efficacy, we chose to become a practice that just specializes in the band. You're not going to get information from our practice about another surgery. You're going to hear about the band. We're going to teach you how to use the band. And we did this because it's the safest weight loss surgery available.